Hey Begin Peeps, this is Bernard Jin. Hope you're having a great day. This is a case that I did 5 years ago, and I had the privilege of having the patient return. So this is a case where the patient had an implant, a long-standing implant, in his upper right central incisor. And wouldn't you know it, the soft tissue started to demonstrate some level of dehiscence. When we looked at the soft tissue, you can see that, all right, this area has received a lot of surgery in the past. I believe the patient had root canal surgery and things didn't go well, and eventually they lost a tooth only to have an implant placed. But because the area had been worked on so many times, the soft tissue was not as robust, and thus we got to see this implant exposure on the gingiva. So when we take the x-ray and we superimpose on it, we can see, well, it's close to the platform, but it seems to be part of the metal collar. So I wasn't too alarmed. However, I anticipated that part of the thread was probably exposed, and my attempt was to try and salvage this implant. After all, it had been there for quite a number of years, I believe over 15 years, when he came to see me. And when I got to look at the area, I figured, hey, let's do what we can to try and salvage this. We took a CBCT scan, and as you can see, you could see the outline of the existing bone. And yes, we do have some buccal thread exposure as we do the soft tissue exposure. So naturally, I raised the flap, partial thickness, to expose the area. In doing so, I was able to visualize the exposed implant, and I just started to work on it. This instrument is called the R-brush. It is a metallic brush designed to clean titanium surfaces. And after I cleaned it, I then proceeded to do a partial thickness rotated pedicle flap. And here I am going to the adjacent soft tissue, and I'm raising a pedicle flap. And then from this pedicle flap, which is partial thickness by the way, I'm now rotating it over the defect. And this is me releasing the pedicle flap so that it is not under tension and that it moves nicely laterally. I go to the tuberosity. I harvest the maxillary tuberosity because I happen to like the quality of the connective tissue that I get. It is usually dense, thick collagen fibers. It is robust and it allows me to manipulate it quite nicely. I take that harvested tuberosity and I fillet out the epithelium that I don't want, leaving the connective tissue. Of course, any fatty tissue is removed and I'm left with a nice, robust piece of connective tissue. I then place my connective tissue over the graft site, and then I move my pedicle flap laterally, as you can see here. After I've done that, I suture everything up. In this case, I believe the sutures were 5/0 polypropylene sutures, and I sutured it nicely to secure the rotated pedicle flap, and I left the harvested pedicle flap site over here to heal over by secondary intention. This is what the area looks like 2.5 weeks after the procedure, both the graft site and the harvested tuberosity site. And then this is what it looks like at 5 weeks. I then discharged the patient, hoping that I would see him again, and wouldn't you know it, he shows up 5 years later. So 5 years later, this is what the site looks like. I'm pretty excited. I lift up the lip, and this is what I see. You can see that the secondary intention had healed up nicely. The connective tissue graft that I placed over the defect had integrated, and the rotated pedicle is also integrated. When I look at it up close, I'm quite happy. There is some attached gingiva around the cuff of the free gingival margin. I'm relatively happy, and I would say this was a win, considering that this was a pretty dodgy case. In comparison to what it looked like before, so this lower image is from 5 years ago, and the upper image is current day, I'm relatively happy. And in comparison, when we look at the radiographic image, it doesn't look like it's changed a whole lot. So in all, I believe this was a win. This was not a typical case that I do all the time. However, it's nice to be able to follow up on a case where I was attempting to salvage the implant, and it seems to have worked out relatively nicely.